All right, let's talk a little pathophysiology here. When we have somebody that is actually going into a shock state, this is basically a collapse of their cardiovascular system. It could be because of other parts of the body systems that are actually affecting the cardiovascular system. But remember, like I said before, when we're talking about shock, we either have a pump problem, also known as the heart, the pipe problem, veins and arteries, or a fluid problem, which could be blood or water or anything else, plasma, that we're actually losing that's leaving the cardiovascular system. So when we're talking about perfusion, remember we're talking about an actual pressure system. We have to have enough pressure in our pipes. We have to have a good functioning pump, and we have to have enough fluid in order to fill that space so that we can get that oxygen molecule to go all the way down to our big toe and offload into our system, unload the CO2, and bring it all the way back into the heart in order for us to get adequate gas exchange. So perfusion is the circulation of an adequate amount of blood to meet the cell's current needs, right? We have to have an adequate amount of blood. We have to have an adequate amount of pressure in order for that oxygen molecule to be able to diffuse into our cardiovascular system, okay? The whole body is perfused via the cardiovascular system. Again, every organ that we have, every cell in our body is using up oxygen that is transported via the circulatory system in order to be able to function and to provide us with energy to stay functioning. So if we have poor perfusion, we are in the state of shock. Remember that the definition of shock is hypo or low perfusion, right? So whether we have a pump problem, something's wrong with our heart is failing on us, or maybe our pipes have too much dilation going on, where the pump's working good, we still have the same amount of fluid, but because our pipes are actually bigger, the fluid doesn't have enough pressure behind it in order to facilitate diffusion of oxygen and CO2. When this happens, transportation of carbon dioxide out of the tissues is severely impaired. This actually builds up a lot of waste for us. This starts to denaturize all of our cells. Our cells start popping and start spilling out all their intracellular fluid. You guys will learn when you move up in level of licensure that it's specifically potassium. Potassium gets into our cardiovascular system. It gets brought back up to the heart, and the heart is very sensitive to potassium. We can go into some very serious, severe, lethal rhythms from having too much actual potassium in our circulatory system because of the fact that we are being hyperperfused and our cells are starting to die off. So us as medical providers, specifically in EMS, we have to be able to recognize the signs and symptoms of shock. It can be very hard to see, right? We can see skin color. Remember that the skin is the only organ that you guys are able to actually visualize. It's the cover of the book. It makes us want to read it, right? If we have somebody that is extremely pale, and I understand that this is the first time that you're actually meeting this person, hopefully there's some bystanders around or somebody or some family members that might know this person. But if that patient looks pale, right, to you, if that patient looks sick, more than likely we are already entering the first or second stages of actual shock itself, okay? So again, shock refers to a state of collapse and failure of our cardiovascular system. It's a pipe problem, it's a pump problem, it's a fluid problem, period, okay? If we aren't able to recognize this in a timely manner, if we are staying on scene too long with our patients, if we are not able to control any kind of bleeding, specifically internal bleeding, and we have the presumption that this person is bleeding internally, you guys are going to hear from me later on in this lecture that anybody, I don't care what age, I don't care what sex, I don't care what gender, if that patient is showing or exhibiting the signs and symptoms of shock, and you can't explain why, that patient is bleeding internally until proven otherwise. Okay, we still have to treat for shock. We still have to get them to the hospital in a timely manner. And there is plenty of different types of shock where we really are just stabilizing the patient in order to get them to that definitive care, more than likely straight to a surgical table, especially if we're talking some kind of traumatic event that happened with our patient. But it could be because of a medical disorder. It could be because of a traumatic injury. And again, if we can't recognize this, guys, if we're slow on the ball, if that 8 ball is more farther ahead than we are, our patient's going to have a very poor outcome. All right, your cardiovascular system consists of 3 different parts, and we've already talked about this. You have the heart, which is the main pump. We have to have a good functioning pump in order to help us circulate all that oxygen-rich red blood to our organs and cells. We have to have a good pump in order to get that deoxygenated blood that's carrying all that acidity all the way back up to our heart via the superior and inferior vena cava in order for that right side of the heart, in order to process that blood, shoot it into the lungs where we can get respiration to occur again. We have pipes, lots of blood vessels from capillaries all the way up to main arteries, okay? And those can give us problems. Those can constrict too much. Those can dilate too much to where we're not actually able to maintain that pressure in our cardiovascular system. Even though we have a good pump, even though we have enough fluid in our system, if those pipes get too big, we're not able to produce the pressure that we need in order to feed the hearts, or order to get that blood back up to the heart and through the lungs in order to oxygenate and all the way back down to our big toes in order to perfuse all the cells that we have in our body so that our cells can produce energy for us. And then we have the fluids, or what I refer to on this slide as the contents. That's the blood and the plasma, right? We have to make sure that we have enough fluid in the body. We want to make sure that the fluid stays in the body. We want to make sure that that fluid not only stays in the body, but specifically it stays in our cardiovascular system within our arteries and our veins. So here it is, a picture of all the big 3 systems, our cardiac, respiratory, and neuro system, kind of all working together in order to achieve this. If we have a collapse in one of these systems, more than likely we have a collapse in the Fick principles. If we have a collapse in the Fick principles, more than likely we're going to enter a stage of shock. Okay, all this works together in order to get rid of oxygen and CO2. And specifically, we're going to talk about oxygen and CO2, but later on in this lecture, we're also going to bring up lactic acid and our hydrogen ions, which are our true acids in our body. Again, in EMS, we see carbon dioxide or CO2 as an acid. I know all you chemistry geeks out there are about to blow a pupil because carbon dioxide is technically a gas, but it does cause some acidity problems for us in our body if we do have too much and or too little. Really, we can have some problems with CO2 because of that. So this is just a picture kind of putting it all together, how the whole circulatory system kind of works in order to perfuse all the cells in our body. So when I'm referring to the fact that it's a pipe, a pump, or a fluid problem, I'm referring to what's called the perfusion triangle. And the perfusion triangle kind of breaks down each of these 3 components, kind of explaining what happens when damage is done to them. You guys can read over that on the slide, and then you guys make sure that you read this portion specifically. I believe this is chapter 12 in your textbooks. Please make sure that you guys are reading over that. This is a pretty important chapter for you guys. Make sure that you guys are reading up on shock. We can have problems with one of these, 2 of these, or all 3 of these at the same time. And we need to make sure that they are working properly together in harmony in order to keep our patient sustained with life. Okay, so we talked about blood pressure already in this class, but remember that blood pressure is the actual amount of pressure of the blood within the vessels at any moment in time. We need to make sure that we are having an adequate blood pressure. We don't want it too high. We don't want it too low. We want it kind of sitting in a nice kind of middle range. Make sure that you guys go back over specifically for EMS what we consider to be kind of the borderlines of both your systolic and diastolic blood pressures. The systolic pressure is the easiest definition I can give you guys is that peak arterial pressure. It's basically how much force does the heart have to pump against in order to get the blood out into the aorta. How much resistance is there being met by the actual heart pumping the fluid out into our pipes. We can have very high readings in this, and obviously the higher we go, the more concerned we are for our patient. The diastolic pressure is the pressures in the arteries when the heart is actually at rest, or when the heart is in between heartbeats. Okay, and we want that number as low as possible. We don't want it too low, but we want it as low as possible in order to make sure that our heart is able to have a good rest before it starts to pump again. Okay. The other thing I want you guys to keep in mind is that when the heart is in diastole, when the heart is at rest, that is when the heart actually receives its own blood supply through the coronary arteries. Okay. So we want to make sure that our heart's not pumping too fast. We want to make sure our heart's not pumping too slow. We want to make sure that we are getting good cardiac output, right? Remember that cardiac output is the amount of blood that's basically being released from the heart, pumped from the heart. We want to make sure that cardiac output is good in order for us to be able to maintain those pressures in our body, in order to maintain the pipes filled with fluid, and make sure that we're able to get the perfusion that we need all the way down throughout our body. When we're talking about pulse pressures, this is a little bit kind of advanced for the ENT basic level, but I do want to kind of throw this out there for you guys, just to kind of bring home how significant blood pressures are for us. And the pulse pressure is actually the difference between the systolic and diastolic pressures. It signifies the amount of force that the heart generates with each contraction. And the pulse pressure less than 25 millimeters of mercury may be seen in patients with shock. So what exactly does that mean? Well, really what it means is that the systolic and the diastolic are actually coming closer and closer together. And once they get right around 25 millimeters of mercury apart, this is when we are truly entering a significant stage of shock. And really, when it comes down to it, we're going to talk about compensated shock, and we're going to talk about decompensated shock. And when we're talking about the difference between compensated and decompensated shock, the difference is the blood pressure of the patient. If we start seeing drops in blood pressure of the patient, we are entering stages of shock that may be irreversible. So the first sign of true compensated to decompensated shock is the drop in the patient's blood pressure. However, it's not just the actual blood pressure that we need to be able to maintain in order to help us keep the pressure within the system. When we're talking about our actually capillary beds, the blood flow through them is actually regulated through what we call capillary sphincters. This is completely under control of the autonomic nervous system. This is the involuntary part of the central nervous system, right? This is what controls your sympathetic and your parasympathetic nervous system, or your fight or flight, or rest or digest. The capillary sphincters respond to numerous different stimuli. The big ones is heat. Right? If we get too hot, our capillary beds, our veins, our arteries are actually going to dilate in order to try to get that heat to escape. Okay, we're going to start getting sweaty in order to try to cool our body down. If we get too cold, all those capillary sphincters and capillary beds and veins and arteries are going to start to constrict in order to try to kind of get the actual blood out of our peripherals, or shunt our blood away from the actual parts of the body that can go without blood for a little bit, or at least for an extended amount of time, I guess is the best way to put it, and to bring that blood back to our core in order to keep the organs and our core warm. in order to try to preserve that heat so that we don't go into some kind of MODS or multi-organ dysfunction syndrome, where organs just start shutting down because we get too cold, or organs start shutting down because we're shunting the blood to more important areas. Remember that when we are in a true state of shock, we are shunting our blood in order to we're shunting our blood to our core in order to provide as much oxygen, as much nutrients, as much waste removal to our big three systems, and that's our cardiac, respiratory, and neural system. Gas exchange at the cellular level requires more than just having a working cardiovascular system, and we've already kind of touched on a couple points of that. We need to make sure that we do have good oxygen exchange. We need to make sure that we can get the oxygen in and out of the body in the first place, right? That's FIC number one. That ventilation. We need to be able to have that mechanical movement of air in and out of our lungs. We go to FIC number two. We need to have respiration. We need to be able to have an adequate amount of pressure in our lungs, partial pressure in our lungs, in order to help with the diffusion process of oxygen and carbon dioxide at the alveoli level. Okay. We need to have nutrients. We need to have be able to get glucose, which is sugar, to our cells. In order for our cells to be able to process it, we need to be able to get that glucose into our cells. So we need to have enough insulin production, which we're going to talk about more, or an efficient amount of insulin production, which we're going to talk about more when we get into the endocrine system lecture. And then we have to be able to have a good functioning set of lungs, and we also have to have a good functioning set of kidneys, or our renal system, in order to help us remove all the acid out of our body. So our blood buffer system needs to be intact, our respiratory or our lungs need to be intact, and we need to have good functioning kidneys in order to process all those hydrogen ions, which you guys eliminate by peeing or urinating, in order to get that stuff all out of our body. So we do have some mechanisms in place, specifically our autonomic nervous system. Remember, this is your involuntary control system in the central nervous system. And hormones. And these mechanisms are in place to help support the respiratory and cardiovascular systems when the need of perfusion of vital organs is increased. Okay? So we got a lot of stuff going on, guys, right? We got the big three systems: our respiratory, our cardiac, our neurologic systems. We have hormones in place. We have a little bit of the endocrine system in place in order to help process all this waste and all the nutrients in our body to keep us functioning. So when we're talking about hormones, remember, hormones are just chemical messengers that are released from our brain in order to send a signal down to certain organs or certain parts of our body in order to create some kind of response. Okay, so hormones are triggered when the body senses any kind of pressure that is falling in a normal, healthy adult. Okay, there are some disease processes out there where the body kind of senses, itself are depleted. It doesn't have the ability to do this anymore. And naturally, as we get older, our body does slow down with our hormone production in the first place. Okay. However, these hormones can cause an increase in heart rates. They can make the heart actually squeeze or contract harder, and they can also what we call peripheral vasoconstriction. And peripheral vasoconstriction is like what I'm talking about, when the blood actually is shunting from our extremities in order to get to our core, in order to sustain the big three systems when we go into shock. All right. There's times in our lives where, man, I don't need blood flowing through my hand at this very moment. I don't need blood flowing through my feet or my lower legs or my lower arms or anything like that. I need that blood towards my core. So that's why we can shunt or peripheral vasoconstrict, right? We can have our body squeeze down and all of our veins and our capillaries, starting from our fingertips and working its way proximal all the way up to our elbows, proximal all the way up to our shoulders, in order to keep that blood in the core of our body, in order to help function or meet the demands that the body is needing at that time. So if you guys remember, I gave you guys that example of where I get you guys to stimulate your sympathetic response. I'm going to get you guys naked. I'm going to put some raw steaks on you. I'm going to throw you in the room with a Bengal tiger that hasn't eaten in a couple weeks. Your sympathetic nervous system is going to kick in. When your sympathetic nervous system does kick in, remember, that's all hormones. That's adrenaline. Your brain senses danger. Your eyes see the danger, right? Your heart rate's going to speed up. Your respiratory rate's going to speed up. Your pupils are going to dilate in order for you to bring in as much light in the surrounding area for you to help you find an escape. Okay, you're going to start breathing faster. You're going to start sweating, right? This is all hormonal response. And while you're doing that, believe it or not, okay, you are starting to peripheral vasoconstrict. I don't need those blood in my hands right now. I need that blood going to my heart because I have to find an exit. My oxygen demand is up. I need that blood to be flowing through my circulatory system and my core in order to keep everything functioning, in order for me to jump up and get the hell out of that room. So all these mechanisms, our brain, our lungs, our heart, our vessels, our arteries, our capillaries, our veins, our hormones, right? All the ways that we can eliminate waste, our blood buffer system, our lung buffer system, our renal buffer system. This all has to work in harmony in order to maintain pressures in our system and sustain perfusion to all of our vital organs and cells. Okay, it is the response. If one of these systems are not operating appropriately, whether it's due to a medical condition or whether it's due to some kind of traumatic event that we have suffered, it will cause all the signs and symptoms of shock to be seen. Okay, and remember, the true first signs and symptoms of shock that we can see in EMS is the patient's mental status. Okay, the patient's mental status, they could just be confused. That could be the very first signs and symptoms of shock. They could just be irritable. That could be the first signs and symptoms of shock. They could be restless. They could be trying to find that position of comfort, right? That could be the very first sign and symptom of actual shock, where for whatever reason that patient feels like they need to up and leave. Their sympathetic nervous system is on overdrive, and if we can't explain why, more than likely this patient is in a stage of shock, and more than likely they could be bleeding internally, which we will not be able to see in EMS. Okay? It's very easy to see a gunshot wound. It's very easy to see if somebody was stabbed in the femur and there happened to be spurting blood out of their femoral artery, okay? Or out of their carotid artery, wherever the hell they were stabbed, right? But if we are seeing somebody that for whatever reason we cannot explain why we are seeing these signs and symptoms of shock, we have to assume that our patient is bleeding internally until proven otherwise. They are hemorrhaging blood out of their cardiovascular system into their third spacing of fluid within our body. We're going to talk about third spacing here in a minute when we talk about our fluid compartments, and that should be coming up in our next lecture.